পানি দাও এখানে। কে জয়েন করলো? সুমাইয়া, শুনতে পাচ্ছ আমাকে? সুমাইয়া, তোমার মাইক অন আছে? আবার চলে গেছে। হ্যাঁ, নাই আগের। তোমরা কি বলে বাক্সে দাও কিনা আমার সন্দেহ, তো গন্ধ লাগে না যে। আগে থেকেই আছে। দেখি এটা বন্ধ করতে হবে। ফোকাস ঠিক নেই। This is the lymph node, this is the common duct, this is the rubeus sulcus. So we will keep above the rubeus sulcus. This is the lymph node, we will dissect above the lymph node. Little coagulation here. If we keep above the rubeus sulcus, there will be minimal chance of injuring the common duct. Here is the common duct, here somewhere is the cystic duct. We are dividing the branch of cystic artery on the gallbladder wall. You see the division. Now we will come down parallelly. Here is the lymph node. So the vessel distal to the lymph node we have divided and we are dissecting so that the lymph node along with the main cystic artery fall down medially. Now we are going posteriorly, that is on the lower inferior surface. And we are keeping at least 2 to 3 centimeter away from the junction of serosa with the liver bed, so that from this region bleeding does not occur due to tension. Take little tissue at a time so that we do not injure any unintended structure. Now on this side, we can see the lymph node here. You see that we have exposed the area we need to deal with the cystic duct. Okay, this is the end of the vessel. This is the lymph node. This is coming medially. Just little dissection here, and our main job will be done. Little dissection on this side. I do not think we will need more. Just a bipolar diathermy here. The area here. This is the lymph node. This is the end of the divided vessel. That region is well coagulated. Just is done. This is another buster. You see the lymph node. This is the end of vessel. We do not need to do anything here on the main cystic artery. Now we will put two ligations, one towards the common duct, one towards the gallbladder, and divide between them. Okay, almost flush with the common duct. To bipolar curve. Before going for another knot, just little blood stain here. So we will try to handle that. Okay, I think. The suture material has good memory, so tries to disturb me. There could be a stone between the ligatures. For
dissection
from its bed into the liver. Nothing here. Okay. We can now proceed with the further
Dissection
dissection of the gallbladder from its and, as I said, keep lever that will prevent bleeding from the junction of peritoneum, that is serosa, with the liver. Yes. And try to be on the gallbladder wall, a bit away from the liver, so that there is minimum chance of injury to the liver during this dissection and minimal chance of bleeding, because bleeding from the liver is very difficult to manage. So our job is done. We will now bring out the gallbladder and close the pores. Now we will release the gases so that the abdominal umbilical port side becomes relaxed, and that will allow easy retrieval of the gallbladder.